Okay, hello everyone, and it's been quite a long time since we had our last medical reality talk show, and we are excited to be back. And this is our 30th edition, so that means we've been now. But yes, we had some um, slow down transition. The a lot of our team members travel different part of the world. The team were most strong in China, and then I have to come back to Liberia last year, and some other team members for different programs, residency in the US. So we've been trying to get our team back together from all around the world. But I'm excited that we can be here today on the 30th edition of the International Christian Medical Fellowship, specifically our medical reality talk show. And I have with me a very special guest today that I've known for a very long time. I'm a very close friend and a sister, a colleague, and talking something. Our topic today is in her area of specialization. And so it's going to be an exciting topic. It's good to have you today, Dr. Ki Yakasa.
Thank you very much,
All right.
Bala.
Yeah. So we have with us today Dr. Tommy Yekesa, and we're going to be discussing in the next couple of minutes. We'll be talking about cervical cancer. You know, this month is breast cancer. I know somebody said, "Why you not talking about the breast? You're talking about cervical cancer." But yeah, we'll be talking about the breast. But that's is we're talking about the ladies. We want to create the awareness for our mothers and our sisters and for everybody as a whole, because it's a concern, and we're supposed to be talking about breast cancer next week, but today trying to go back to last month or the previous month. That is the month of cervical cancer or ovarian cancer. I learned it's supposed to be ovarian cancer. And so we thought to have the discussion today on cervical cancer. And I'm Dr. Augustine Kimbala. I am not an OBGYN specialist or medical oncology. I am a neurosurgeon. And so I have with me the specialist obstetric gynecology, fresh, graduate for that matter. So all the books and everything, the fresh experience is there. She will be talking to us today. So Dr. Yekasa, do you want to briefly introduce yourself?
Okay, thank you, Dr. Bala, and hello to everyone. Um, I am, as you heard, Same Yekesa. I am uh, obstetrics and gynecology specialist, and I trained with the Liberian College of Physicians and Surgeons, and I am currently practicing within rural Liberia. So it's a pleasure to be able to share um, like some highlights on a very important topic affecting women all over the world, and of course, especially in our region, which Liberia is no exception to the burden of cervical cancer in sub-Saharan Africa. Thank you.
Okay. Thank you, Da, and thank you for accepting to be with us here. And as the discussion goes on, we are live streaming on Facebook and YouTube and all our other platforms. So whatever platform you are watching from, we be excited. We'll be glad and sending your comments. We'll be able to read them. If you have questions along the way while we are discussing the topic, you can also ask your questions in the comment section, and we will look there and be able to read some of the comments out and then response to the one we can respond to. So, Dr. Sa, is good to have you again. I know Mr. Sa now carry the doctor title, but please forgive me if I said Dr. Yeke as well. Anyway, we'll put all together Dr. Yeke Sa. So we're talking about cervical cancer. what is it? What would be your definition for cervical cancer? That even for the non-medical person, my grandmother up there in Lofa County, we maybe kind of have an idea as to what it is. A layman definition.
So, in simple terms, cervical cancer is a disease, and it affects the cervix of women, and it is the cervix is the lower part of the uterus, what we call the womb. So it's a cancer that affects the lower part of the womb, and uh, it is located somewhere close to the vagina, the urinary bladder, and of course the rectum. So is that part of the woman's reproductive organs that the cancer, cervical cancer affects. And of course, cancer, if I were to just say what it is that uncontrollable growth of some organ cells that kind of uh, grow to disrupt the function of that part of the body. And so it it could spread to surrounding structures. So that's why in the definition, I was able to tell you what part of the woman's body the cervix is located. So obviously, this cancer could grow beyond the cervix and affect even the vagina. It could affect the urinary bladder or the rectum, for example.
Wow. So, there was a very interesting, um, uh, joke in medical school about cervical cancer. We're talking about cancer, and then people measuring the different kind of cancer. And somebody wanted to be, sometimes we just want to be part of the conversation as well. And but
Okay.
knowledge is power, right? So to be part of the conversation is good to have the knowledge. So it's not a question to, I know you're a specialist, but I think kind of question to bring the ordinary people back along with the conversation as well. So I know women are the one who have service. So we're talking about cervical cancer. I meant part of this discussion.
So of course, men is part of this discussion because um, every man has a mother, first thing to do with. Every man has a wife, or they have that social intimate partner that they call their own. So obviously, if any disease affecting um, a woman,
Yes.
and of course, in this reproductive part of the woman is key to everyone because the continuity of even reproduction or your sexuality, for example, can
Exactly.
be
So the point is
affected.
that in as much that we don't have a service, but we are part of the discussion.
You are. Men
Yeah.
is part, yeah.
Okay, that. So maybe to, you were talking about cervical cancer being one of the most common cancer. When people hear that word cancer, very afraid. Talking about it being one of the most common cancer, especially in Liberia. What is the epidemiologist like?
Yeah, so globally, the WHO ranked it as the fourth common cancer affecting women, and uh, that is about you counting some six hundred and 60,000 women annually being diagnosed of the disease, and it causes close to 300,000 deaths annually. So it's a common occurring cancer, and of course, um, there is a disparity where you have most of the incidents occurring within low to middle income countries, and especially in regions such as sub-Saharan Africa, in the Middle East or Asia, among other regions. So it's a common disease, and so in those countries with the highest incidence, like for example in Liberia, you have it ranking as the number one gynecological cancer, where
Wow. So,
we see, yes, we see about up to 600 plus cases per year.
oh, wow. Wow. So,
Yeah,
if I get you right, it is the is ranked as number one gynecological cancer in Liberia.
yeah,
So
yeah.
it's a really major concern in Liberia. Yeah. Wow.
Yeah, and it's similar to some of the pictures that have been found in the sub-region, like in the northern part of Nigeria, is also ranked as the number one cancer occurring in women in northern Nigeria, and in like the eastern southeastern part, although it is second to breast cancer in women. So obviously, cervical cancer is really high.
Wow. So
Yeah.
it's a disease of concern. I think that require awareness. People need to know about it. How can they be able to kind of sense? I think early diagnosis is quite important, and we if we'll be able to catch up with that early diagnosis and to have better prognosis, then I think one of the things that is of great concern, people need to know what are some of the risk factors or the etiology. We want to talk about that, considering cervical cancer being the most common gynecological cancer among women in Liberia. I think it's quite important for us to be able to look at some of the risk factors so that even the ordinary Liberians should be aware of that will help with early diagnosis. So, what are some of the risk factors associated with? Maybe you can also talk about etiology.
Yeah. Thank you very much. So the hemopapilloma virus, uh, which is the HPV virus, has been labeled as the major cause of cervical cancer, accounting for more than 99% of all cases. And um, some of some of the major risk factors, are usually uh, linked to the infection with the HPV sexually transmitted infection. So that's what makes it unique, because this cancer has a causative agent,
Mm,
and that can be diagnosed, and that can be treated, as well as even prevented. So some of
okay.
the major risk factors are usually preventable, risk factors, like they are behavioral, high risk behavioral patterns that can be changed. So you want to look at, for example, you want to look at early age onset of sexual activities. So people who have their coactivity at an early age, they are at high, they are at high risk of developing cervical cancer, because we say HPV accounts for about 99% of the causes. and is a sexually transmitted infection. And important to note, it is not, its transmission is not prevented even by the use of condom. So even if it were oral sex, or it was anal sex, or any other physical intimate contact with someone infected with the virus can still be transmitted. And another important thing is about having multiple sexual partners, and people who are married to somebody who's having multiple, sexual partners, or
Mhm.
those who are smoking, for example. So yes, a woman may be committed to just a partner, and they may have only one lifetime sexual partner. But if their partner is on the other hand not committed to them, they are still at high risk
Putting our
of
race.
exposure.
Okay.
Yes. So, and women who may have multiple, childbirth can also be at risk. So, other risk factors can range from familial predisposition, where a first degree relative with cervical cancer who gave a red flag that you can watch this or screen this person, they are likely to develop it. Those
Mm.
who have immune inhibition, like those uh, who have their immunity suppressed, like in the case of women living with HIV and AIDS, for example, they are about 6 times at higher
Wow.
risk of developing cervical cancer than women of the general population. So you can imagine that. And
Mm.
some people who may be on immune suppressive therapy like steroid, chronic use of steroids, can also be at a high risk. And sometimes those who have long-term use of combined oral contraceptive pills, those things have come in at a lower, at the bottom of the risk factor. But the good thing is most of these risk factors are actually preventable.
Okay. So the more we can say modified, right? These are
Yes,
behavior things talking about having multiple sexual partner. That's modifiable thing. You
it's a
can
choice.
be on pressing. Yeah.
Yes, it's a choice, and you can decide.
Uh, like women who have a lot of children, you can decide as well. So not just economic reason, you could decide to have
Yeah,
2 3 um but I think these are quite important, and I think these risk factors, especially these modifiable ones, these behavioral ones, something we could talk more about over and over so people can know. And again, that's what we said from the beginning, men are part of the conversation, right? Because if you
yes,
have a woman who is faithful to one spouse, and just one husband, but that man is also having multiple sexual partners, put the woman at risk of having not just sexually transmitted disease, but even dangerous killer like cervical cancer. So that's make the men to be part of this conversation as well. And so I think this is not just about Christians or pastors or church girl and church boy. Maybe you would call us, trying to talk about, being a good, husband, good wife. It's also health related, right? And so being faithful
it
to your partner, it's not just the religious thing. Of course, we will say it from the Bible. That's the right thing to do, and that's what God wants us to do. But it cross down here again, coming to health, right? Cheating on your wife, you'll not just be harming your body, you also be bringing disaster, disease, like, putting your entire family, your wife, as well at risk of cervical cancer. And many others you are kind of mingling with. So that's quite good there. But let's talk about what are, if the damage is already caused, what are some of the management, like treatment? What can be done if somebody kind of went to the hospital and you realized, well, doctors say you have, cervical cancer. What could be done for the person? Is it a death sentence, or you can be treated, you can get okayed again? What is the management or treatment options that are available?
Yes. So the good news there is that this condition, cervical cancer, is one of the treatable diseases. In other words, it can be cured. It's not like everybody knows cancer doesn't have cure. Cancer doesn't have cure. But in the case of cervical cancer, it's one of those fewer type of cancer that can be treated and
Can be
clear off
treated.
completely.
Wow.
So, and this management will require the first thing you have to be able to diagnose it. You have to know that the person has the condition. You have to be able to provide clinical care, ranging from uh, 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 you know getting the patient complete history. Remember, it's a whole disease process that take over 15 years. For example, if a woman got infected with the HPV virus, they take up to like 10 to 15 years to transform into cancer of the cervix. So you have to know the person's history, because some people may graduate from having multiple sex partner and they got refined for some reason. They got at a point in their time, they modify their lifestyle, they're committed now. So they may even have forgotten that somewhere there they were having,
Mm.
yes, those kind of risk behavior. So you have to get a complete history of the patient. You have to do a thorough gynecological exam of the person. And of course, we got imaging modalities like ultrasound that may be able to help you to identify the lesion, the cancer lesion on the cervix, and it can tell you and define where exactly it is. And of
So, so,
course,
so,
you
so,
can
so, in
do
short, so we are saying that diagnosis is quite important when it
it.
comes to management. Yeah.
It is
So
very important.
that also put this in here that talking about diagnosis. You, currently, are we sophisticated to be able to do any diagnosis? In Liberia.
Yes. So currently, at the annual convention of General Convention of the Physicians and Surgeons, the College of Physicians and Surgeons, we were informed that currently there is one histopathological uh, center in Liberia, because
Okay.
cervical biopsy is the gold standard for diagnosis of
Okay.
cervical cancer. So, and there's only one diagnostic pathology or histopathology center. So definitely, uh,
And what
you
is that?
can,
Is that
but
JFK? Is that
it is
JFK?
only in, yes, it is only in the capital city of Liberia in JFK. And
Okay.
so all parts of the countries, for example, have to get a patient to Morovia, or some way, somehow get specimen and sent to Morovia. And imagine why it comes with transporting these things, can be people even a fool and more other things. So
Yes,
your
but
diagnosis is key.
yes, so but at least we can be able to do histopathology here in Liberia, right? So because I know
Yes,
years back
definitely.
you have to probably go to Ghana or somewhere else, so we can do histopathology here and be able to confirm diagnosis. That's good. So in terms of
Yeah.
that, if diagnosis is kind of confirmed, what in terms of treatment, what is it? So what are the options available currently in Liberia?
Yes. So for treatment modalities or approaches, it depends mainly on the stage at which the disease is diagnosed,
Okay.
and the treatment options, depending on how advanced how early the disease is. You can do a simple surgery, where you do a hysterectomy, for example. That includes removing the uterus and that of the cervix, which is part of the uterus. And of course, you can do surgery, and you additionally go into chemo therapy, for example, depending on the stage. So between stages I advanced about two or three and four, definitely you have to go to radiotherapy, you know, and that part of the treatment management is now within Liberia. So most of our patients, we have to refer them out of Liberia.
So that's where the surgeon and the medical oncology have to work together, or the
Definitely.
radiologist when there is issue of radiotherapy. Yeah, and so we have
Yeah,
5 more minutes to go. Thank you, Dr. Janeta Maningogo Hatch, and thank you, Tomon Gavler. Those of you that are following us there, you thank you for commenting there. So we're gonna be taking questions. So please, if you have questions, you can put it there in the next 5 minutes as we close our discussion today. But we want to say thank you for following us and thank you for listening to this very important topic on cervical cancer. I have remained today as my special guest, Dr. Yek, specialist obstetric and gynecologist, a proud product of the Liberian College of Physician and Surgeon. So that talking about we're talking about the management, but and then you also said that especially when you talk about the risk factor, most of them are modifiable. So that brings in the opportunity for prevention. So talking about prevention, what are some of the advice you would give, or what are some of the things we can do to be able to prevent cervical cancer?
so you said earlier, knowledge is power, and uh, I want to say bravo for this topic on your show, because everything begins with the information, the right information, knowing what something is and knowing what to do to prevent it. So definitely education and awareness about cervical cancer is the importance of the awareness is nothing we can overemphasize. But the WHO had the 1970-90 strategy, global strategy plan that they are targeting to by the year 2030, they should be at least able to have vaccinated 90% of all girls by the age of 15 years. They should have been able to screen women, 70% of women in every country, and they should be able to get 90% of those diagnosed with cervical cancer to have access to treatment. So all of these things, remember we said the major cause is the hemopapilloma virus. So it is the vaccine, the hemopapilloma virus vaccine, that they encouraging everyone to get. And of course, once you are vaccinated, up to three doses, you are the coverage, you are protected against, the likelihood of contracting cervical cancer. And of course, if you cannot get vaccinated or you above the age, they want you to screen. They want you to go to do the HPV DNA testing. In some of the lower income countries like Liberia, we may not have access to those testing, but we encourage the conventional pap smear cytology, that is simple, where we take a tissue from the swab from the cervix, and then we can check it
So
in the
is
urology lab.
is the accessible is available? You think people can access the vaccine in Liberia currently?
Yes, the vaccine is available in Liberia, and it was rolled out some 2 3 years ago. So it is available in Liberia, and you can take your children between the ages of 9 to 13, I'm told, to get vaccinated.
Wow. So
Yeah.
vaccine is quite important as part of measure. We want to encourage you to seek that, prevent and modify those behavior that are risk factor. And so that as we go to the close, what would be your parting statement? Before your parting statement, let me say thank you to those of you who've been following us. And you can stay putting your questions, your comments. You watch this show later on, we will still be able to see that comment. Saying we could not get the questions live as well, we can still respond when you're putting questions or comment later on. So we want to say thank you for following us. So that would be your parting statement, and what would be the take-home message for anyone following this show today about cervical cancer?
So I want to encourage everyone who has had the opportunity to be here today to maybe for the first time or to get increased information on cervical cancer, to be an ambassador to not just your relative. You can talk to a colleague at work. It's important for our women to get their gynecological exams, for example, even if they don't feel sick or unwell. Is important because just a routine pap smear done every 3 years is enough to know that you are safe and you can modify your lifestyle to improve, um, to lower your risk for cervical cancer, and of course all the burdens that come with cervical cancer. Thank you very
Wow,
much.
thank you so much. You've been following the Icmfel Medical Reality Talk Show, and like I said, this is our 30th edition, and we're gonna be back next week by God's grace. Here on Saturday, same time, probably with another exciting topic, maybe the same guest or another guest, but just watch out for that. We want to say thank you for following us and thank you so much, Dr. Yakasa, for joining today. Thank you for accepting our invitation. Amazing, your very busy schedule. You're very busy. Somebody asked, how do you do that? I said, I do not make time for things that I consider important to me. But so definitely, I know it is not your free time. You just make the time to be here so that we. And to all our
Thank you.
viewers, yeah, and to all our viewers, we also want to say thank you and bye bye for now.